Well, thank you, Dr. Sedin. We're going to have questions after everybody speaks. So the next speaker is Mr. Jeff Todd. And Mr. Todd is Chief Operating Officer of Prevent Blindness America, and he's really expanded that role and done a lot of things in his tenure there. He's been working to ensure the integration of efforts across the organization's various departments, coordinating strategic planning, and also expanding external partnerships and communication within the vision and eye health community. He established the National Center for Children's Vision and Eye Health to promote a continuum of healthy vision for all children. He also fosters a national forum for the advancement of public health and vision and oversees the development of research that has become widely used to capture the scope of problems of vision disorders in the United States. So he will be speaking on behalf of Prevent Blindness America. So, thank you.
Good morning, everyone. Thanks for having me. I wanted to start out by sharing a little bit about a recent initiative that was a collaboration of the CDC, Robert Wood Johnson Foundation, and the CDC Foundation called the 500 Cities Initiative. And the purpose of this is really a laudable one. It's to allow cities and local health departments to better understand the burden and geographic distribution of health-related variables in their jurisdictions. But you can see something missing here. Of the 27 chronic conditions and disease issues and health issues raised, there's not a single mention of vision and eye health. And this, despite the fact that that vision is ranked, and this is by the Robert Wood Johnson Foundation, that eye disorders are the 7th leading chronic condition across all age groups, 5th across those 65 and older, and 3rd of those among children. So it's a pretty glaring gap. And I bring this up because data matters. If it isn't measured, it isn't done, and this really has been the case for vision for far too long. Prevent Blindness and our National Center for Children's Vision and Eye Health thank the National Academies and the committee for all the work that was put into this report. As the report concludes, vision impairment and blindness are appropriate targets for surveillance because they adversely affect a large portion of the population. They affect populations unequally. They can be improved by treatment and preventive efforts, and they'll become an increasing burden as the population ages. At Prevent Blindness, we believe that strong research and surveillance must be at the core of any public health approach to advancing vision and eye health. For the past 20 years, we've partnered with leading researchers to gather and publish data related to the prevalence and cost of vision problems through our Vision Problems in the U.S. initiative. And we're very pleased that the CDC and NORC have stepped up to establish the beginnings of a new surveillance system. However, this work is currently still strongly dependent on long-standing existing studies that have been used for decades. What we really need are new data collection efforts, such as an expanded NHANES module that are designed to support estimates of the full prevalence of vision conditions at the national level. As it relates specifically to children's vision, and I strongly represent many of our advisors for the National Center for Children's Vision and Eye Health who are here today, as well as Kira Baldonado, the director of that center. But as it relates to children's vision, there's a lack of data at both the state and national level on the proportion of children receiving vision screenings and eye exams and securing necessary treatment to ensure healthy vision. Our advisors recommend that efforts to integrate vision care data with other child health data should build on existing state-level approaches to data integration. Again, it's difficult to begin to address this significant problem without having a complete understanding of its scope. No standardized system is in place to track children's eye health across providers and screening sites. Improved surveillance is critical to ensuring that access to services and treatment are provided in a targeted and an equitable manner, and that's really across the age spectrum. I also want to stress a little bit the importance of capturing the impact of comorbidities throughout research and surveillance. As we all know, there are multiple conditions that often coexist with and/or result from vision problems. In fact, among the 11 chronic conditions included in the Women's Health and Aging study, vision impairment occurs as a comorbid condition in 6 of the 10 most common pairs. However, many health initiatives at the community, city, and state levels do not fully take into account either the broad range of vision disorders and their comorbidities or their consequences for health and quality of life. As some of you may have seen, I recently broke my leg, and one of the downsides or upsides of that is you get to see a lot more TV than you usually do. So last weekend, and many of you may have seen this on CBS Sunday Morning, there was an interview with Melinda Gates, and as she was discussing the impact of her foundation on global health, one of the things that she talked about was that while her husband is well known for his love of data and science, she said that that's certainly a passion of hers as well. And she said something that certainly resonated with me as I was thinking about this presentation. She said, data tells us where to go and how to act. And I think that's really important for the work that we do in community health and serving our communities. So I really hope that we can come together to figure out how we can make sure that vision and eye health ends up on this list during its next iteration. So thanks for your time.